Patients that visit Peterson Health for surgical procedures have a lot on their mind. They're apprehensive about the anesthesia, the operation itself, and the recovery that follows. But very few patients stop to think about the actual tools and instruments that are used in the operating room. How are those items cleaned and prepared for their surgery? What happens to those instruments after the procedure is complete? How are those items tracked, and how soon are they used again for another operation? Just as with so much of the activity that takes place inside any hospital, the Peterson Health Sterilization Department does its work behind the scenes.
We are kind of in the background and most people don't know what we do. We are responsible for the cleaning of the surgical instrumentation after it's returned from the surgical suite, and we provide services to multiple departments throughout the hospital and the ambulatory center. Our facility is inside the perioperative suite, so the instrumentation is delivered by the surgical technicians to our department where the point of use cleaning starts. Usually the technician will bring a case cart which will have soiled instruments. They'll ring a buzzer in SPD and the technicians will respond to that. It is very important that immediate cleaning of those instruments start so a biofilm doesn't build up. Biofilm is hard to break down and it makes it more difficult to clean. Yeah, the first step in the pre-cleaning is a manual cleaning. So we actually have sinks that are ergonomic that go up and down depending on the size of the technician doing the pre-cleaning. This adapts to their physical stature. After the pre-cleaning or the manual cleaning in the sinks, the technician will sort and put the instruments in a basket. The basket will then go to be scanned into a washer disinfector or an ultrasonic for the next step of cleaning. We have 2 washer disinfectors, and that's for instrumentation. Then we have a cart washer that is also validated for instrumentation. So we can actually put the carts into the cart washer for cleaning, and it's very accurate and better than doing a manual cleaning. And I think that was a big investment by the Peterson Health team. I believe in the Hill Country we are probably the only facility that has that capability. Usually the procedure for the disinfection and going through the washer, there's a wash cycle that may be 30 to 40 minutes long, and then it will come out on the clean side of the sterile processing department where each instrument will be inspected, making sure it's clean, but also making sure that it works properly so that our physicians have no delays during the surgical procedure. After that, the trays are packed in either a container or a external wrap and will be moved to the sterilizer. The sterilizer then has a cycle that takes about 40 minutes to sterilize the tray. Basically, it's a steam is heated up to 275 degrees, and then the instruments are exposed to that sterilant, making sure that it's killing terminal sterilization of the bacteria. We reprocess approximately about 20,000 instruments a month. Each tray is specific for a specialty, including urology, general surgery, orthopedics. And so each tray has a packing list that is, when we pack it, that is followed to make sure the instrumentation is in there that the physician will need. Depending on the volume for that particular day and the set of surgeons working and their caseload, we can operate 24/7 so that the surgeon doesn't see any gaps in his schedule. And I have been a patient, so I realize what the patient is going through, and I think the patient and their family may think about how is the procedure going to go, how long is it going to take, who's my surgeon. One of the things they don't think about, well, who is reprocessing their instruments? So I think Peterson Health has made a huge investment in this, just with equipment and also with the certification of our technicians to make sure that they are up to date and competent and tested on their capabilities. And I couldn't have done it without the support of our senior leaders and the board, because it was a huge investment. But again, we're putting the customer first and making sure we're providing world-class care today, tomorrow, and always.
Peterson Health is the only hospital of this size in the Texas Hill Country that has this type of state-of-the-art sterilization facility. Peterson is committed to world-class, patient-centered care today, tomorrow, and always.